How does an autologous stem cell transplant work in lymphoma treatment? An autologous stem cell transplant is an important procedure for treating certain types of lymphoma, including non-Hodgkin lymphoma. It allows patients to receive high doses of chemotherapy that can effectively target cancer cells while minimizing damage to the body. This process involves several steps that work together to restore the body's ability to produce healthy blood cells after intensive treatment. First, the process begins with stem cell mobilization and collection. Patients receive medications that encourage their own stem cells to move from the bone marrow into the bloodstream. Blood is drawn through a catheter and passed through a machine that filters out the stem cells. The remaining blood is returned to the body. This collection usually takes several hours each day over a few days. Once collected, the stem cells are frozen and stored for later use. Next comes the high-dose chemotherapy, also known as conditioning. After the stem cells are collected, patients undergo high doses of chemotherapy, which may sometimes include radiation therapy. This intensive treatment aims to destroy lymphoma cells throughout the body. However, it also temporarily halts the production of blood cells by damaging the bone marrow. Once the high-dose treatment is complete, the next step is the stem cell infusion, or transplant. The previously collected stem cells are thawed and infused back into the patient's bloodstream. These stem cells travel to the bone marrow, where they engraft and begin producing new healthy blood cells, including white blood cells, red blood cells, and platelets. After the transplant, patients are closely monitored for side effects and complications. It takes time for the new stem cells to restore normal blood cell production. During this recovery period, patients may be vulnerable to infections and might requiring supportive care. Autologous stem cell transplants are commonly used in lymphoma treatment because they allow for higher doses of chemotherapy than would otherwise be possible. This can improve the chances of long-term remission in some lymphoma subtypes. Since the stem cells come from the patient's own body, the risk of immune rejection is minimized. However, this procedure does carry risks, such as infection, bleeding, and potential damage from the high-dose chemotherapy itself. The decision to proceed with an autologous stem cell transplant depends on various factors, including the specific type of lymphoma, how well the lymphoma responds to initial treatments, and the patient's overall health. It is considered a standard treatment option for certain cases of non-Hodgkin lymphoma and aims to achieve durable remission by eradicating cancer cells and restoring healthy bone marrow function. Always consult healthcare professionals for personalized advice and treatment options.